Cirrhosis of the liver is a condition where there is scarring that can develop. In my last post, we talked about one of the causes, which is fatty liver. However, there are other causes that can end up causing cirrhosis, which include hepatitis C, hepatitis B, autoimmune liver disease, and various other liver diseases that can cause scarring. The focus of today's discussion is, what does scarring do? There are 3 things or 4 things that we need to look for when liver gets scarred. The risk of cancer of the liver goes up, so we need to look for that. The second thing that goes up is that there are veins in the throat called varicose veins that can develop in the esophagus, and over a period of time they can bulge up and cause bleeding, so we look for that. The third thing that can happen is weight gain through fluid retention, so a low sodium diet can be helpful. Lastly, when the liver really gets seriously ill, yellow jaundice can develop along with other things that thin the blood. So these are the 4 things that we look for in cirrhosis of the liver. The care of patients with cirrhosis of the liver includes, number 1, making sure we correct the original risk factor. In other words, if it is from fatty liver, sometimes weight loss can help mitigate. If it is from inflammation of the liver, we can treat that. If it's treatment of hepatitis C or hepatitis B, there are good effective drugs for that can help. The second thing that we would look for is vaccinations for hepatitis A and B. If one has liver disease, we try to prevent other liver diseases. So vaccination is one of the foundations of care of liver disease. As mentioned, the risk for liver cancer goes up, so we get an ultrasound of the liver every 6 months to make sure that there's no cancer that develops, along with a blood work called alpha-fetoprotein. In trying to look at the varicose veins in the throat, an upper endoscopy where we go in with a camera, as the slide will show, can tell us how big those varices are, and if they are in the mid-range, we can give medicines, and if they are large, sometimes you have to tie them off to decrease the risk of bleeding. Lastly, a low salt diet, in other words, taking less than 2 grams of sodium per day, is helpful in preventing water retention. Sometimes water pills are necessary. Lastly, liver transplantation is a consideration in people who meet the criteria. Thank you for joining us today. I hope to see you again next week.